In our top story tonight, local pharmacies, big and small, are struggling to keep their doors open. Staffing and billing issues have led to some closures in the Quad Cities. News 8's Jonathan Fong is live in Moline with more on how these issues pose a risk to public health. Hey, Jonathan.
Hi, Linda. We're in front of the Walgreens on 16th Street, which is near South Park Mall. Their pharmacy is set to close temporarily soon, and just to be clear, we mean the pharmacy specifically. The rest of the store will still remain open. Now, the problems with pharmacies aren't just affecting big-name brands like this one. They're also putting strain on smaller, independently owned pharmacies as well.
That's what we're facing in healthcare right now, especially in pharmacy. That we're having to do a lot more with less.
It's a strain on the industry.
All they want to do is be healthcare providers, and it's become very difficult.
With fewer pharmacists graduating from schools.
We're at a point right now that we are in a shortage, mainly because of getting qualified individuals and getting people who are wanting to work in health.
Problems like this leading to temporary closures of Walgreens pharmacies in the Quad Cities. Another major issue covering the cost of doing business.
When you walk in to pick up your prescription, the pharmacies purchase that. And when they dispense it, insurance company reimburses them. And many times they're reimbursed even below acquisition cost.
And another problem, negotiations with pharmacy benefit managers, or PBMs, which act as a middleman, helping to coordinate payments between the patient, insurance company, and pharmacy. But industry leaders say they take more than their fair share.
But the problem is we've seen a decades-long abuse of those entities actually keeping money and stealing it from pharmacies and stealing taxpayer dollars and keeping it for themselves.
With pharmacies understaffed and underpaid, it puts them at a higher risk for making a terrible mistake.
We could actually end up with wrong medication in the bottle and a patient being harmed. And that's the last thing that any pharmacist ever wants to happen. We took an oath to protect our patients, not harm our patients.
Now, Illinois and Iowa lawmakers are working to pass bills to help out pharmacies and patients. For example, Iowa Senator Chuck Grassley is promoting two bills, one aimed at lowering the cost of insulin, and the second one trying to hold PBMs more accountable. Linda?
All right, Jonathan, just how much power do these PBMs have in the industry?
It's a lot. There are three major players in the industry: Optum Rx, CVS Caremark, and Express Scripts. And in some cases, they control over 50%, or they cover, more so, 50% of a pharmacy's patients. Pharmacies that don't agree to their terms risk losing out on a lot of business.
All right, Jonathan, thank you for that report. For a list of the Walgreens pharmacies closing in the Quad Cities, you can go to our website, WQAD.com.